Okay, this talk is about how to crush radiology residency. So a lot of young residents, they're working hard, and it helps for them to have some guidance on how does one get the most out of radiology residency, do a good job, please their attendings, be able to move on to another job. Oh, this, by the way, this cover picture is from a book I wrote called Straight A's to Stanford and On to Harvard. And the key point of the photo is you can see there's a portable table in front of the toilet. You should always have one of these and read every time you go into that bathroom. Read some small, not so heavy book when you void. Put a big textbook on that table to read for when you're making a number two. You'll find you get a lot of reading done that way. Second thing is look at all the pictures on the walls. These are from when I was taking neuroradiology boards. I would put images of things I wanted to memorize, complex anatomy up on the wall. I was told unofficially that I had gotten a perfect score on my neuroradiology boards. They're not allowed to tell you officially. They don't give you a score. You just pass or fail, but that's what I was told. So anyways, I'm going to show you the methods that will help you in radiology residency. Okay, this next slide talks about personal philosophy. Now, simple-minded, ignorant people think, oh, philosophy doesn't matter. They're wrong. It's really important. I can actually tell you the most important thing in learning is personality. I know lots of doctors. Most of them are pretty bright, and it's their personality that determines what they do. So you want to have given thought to what your goals are, what you want to get out of your residency, and what's going to be your approach to the field of medicine in general, radiology in particular, and also your attitude towards learning. And what I mean by that is my attitude was I want to try to become a great doctor. I will do whatever I can do to try to learn as much as possible and get as much experience as possible so that I'll improve my skills. When residents first start out, they don't know anything. They're basically total rookies. It's almost embarrassing how little they know. So you have to keep working as hard as possible to get over that rookie phase. It's also good to have a psychological motivator that drives you. The classic story for me was I remember when I was in medical school and I was studying a lot, and there was some guy, he wasn't in med school, he was in some other grad school, he was a friend of mine, and he said on Saturday, oh, he studied 5 hours, what a rough, busy day of academics for him. And I thought to myself, what a wuss, 5 hours is nothing. If you're interested in really learning, biology or medical stuff, I'll study it. If I'm motivated and it's important to me, I'll study 12 hours on a Saturday at that time in my life. So when you got the motivation, it's easy to study. I wanted to study. I was always looking for ways to create time to study. But if you're doing something because you feel like you're forced to or you don't want to, then it's hard to be motivated. So get your motivation straight, because if you want to have high level achievement, you have to have that. All people who are high achievers, they have a sense of values that drives them to work intensely. I had an Alfred Adler inferiority complex whereby, because I was disappointed with some other part of my life, it drove me to try to do well in my academics. For example, I had been an athlete, gotten injured, and I was so pissed off at myself for having recompeted before I was ready and getting re-injured and ruining my athletic career that I basically was mad at myself and I wouldn't forgive myself. And that, in a sense, drove me that I have to make up for it and create a new identity, if you will, as a scholar and prove that I could be good at something. I was so mad. All my friends, guys who I was much better than in high school, went on to become All-Americans and national champions. And, I did okay, but I was never great again in the sport. So it said, well, I'm going to try to become great at science or medicine. And that really drove me. I never had a problem being motivated. I could easily study all day long until I was exhausted and be happy with it. Dabrowski is a theory of personality disintegration and reintegration, whereby when a person loses something in their life, they can compensate by putting that energy into something else. And that's very helpful. It's very popular amongst the gifted community of students for academics, learning, and teaching. And it's a way to, try to make something positive come out of disappointments in life. The next thing is you want to live close to the hospital. Commuting is a waste of time for learning, so if you can walk to the hospital, that's the best. Okay, so when my residency started, the senior residents, and I went to Northwestern, which is a pretty good hospital, and we had some really good attendings who I liked and I learned a lot from. They were kind of known for doing really well on their boards exams. I had stayed in Chicago because my mother had cancer and we all thought she was going to die soon, and I wanted to be there to help her out as much as I could. I really wanted to go to Harvard, so they told me at Harvard, just sign your name on the line, we'll take you. But I felt, I love my mom. She's the most important person in the world to me. So I said, I'm going to stay local. I went to Northwestern. But in my mind's eye, I was always thinking, man, I should be at Harvard. What am I doing here? And so, anyways, the seniors came in, and these are really good students. Academically, they're all in the top 10 or 20% of their class. And they were giving us a lecture on how we could adjust a radiology residency. And so they brought out a stack of books and said, read this book for, body CT, read this book for neuroradiology, and if you just read these books cover to cover, you'll do fine on your residency rotations and on your boards exam. And I just remember thinking to myself, what a crock of BS. That's completely not the way to think for excellence. And then here's a quote from Oscar Wilde. Only an auctioneer is enthusiastic about all forms of art. Your brain remembers things that you experience, things that you really care about, things that you're emotionally connected to. It's not good. Everybody knows if you try reading a medical textbook, a radiology textbook cover to cover, you're going to be bored out of your mind. The images are going to start to just flow together. You're not going to remember it so well. So I knew right there that I wasn't going to follow that strategy. I would read whatever I saw that day or whatever I was like enthusiastic. Let's say I knew there was going to be a lecture the next day. I'd read about that. And I would read about whatever I had experience with or I saw in conference that day. And that really improved my retention, the memory of what I was learning. Okay, for doing procedures, there's a lot of procedures where complications are rare. For example, doing a cerebral arteriogram, a stroke might occur 1 out of 100 times. There'll be a stroke or a TIA, something like that. So if you want to have experience in handling those types of situations, you got to do a lot of procedures. Whenever there's a choice between go to a lecture or do a procedure, I would pretty much always choose the procedure. If there was a special visiting professor I'd never see again in my life, maybe I'd go to conference, but pretty much, and it was a boring procedure, but pretty much I'd always choose the procedure. You can read about stuff later. You can never get that procedure experience unless you do the cases. As a matter of fact, what I did when I was a resident, we had a rich hospital where we could barely do anything but sit around and watch the attendings and fellows do stuff. And then we had a poor hospital where we could do a lot of stuff. I traded all my time at the rich hospital, said forget this, and went to the poor hospital. That way I could do a lot of procedures. I was doing, cerebral arteriograms. The attending was in the room, but he's allowing me to do the case unassisted when I was a third-year resident. And that's how I got that opportunity. Other residents will never do a single one unassisted in their whole 4 years of residency. So anyways, that's a way to get more procedure experience. The other thing is to understand what's going on in terms of the big picture. In residency, knowledge is the most important thing. Learning about the different diseases, the differential diagnosis, how to recognize the findings and describe them, how to pass your boards and whatnot. But in clinical practice, probably the most valued thing is getting the work done, and the faster the better. Because there's often a lot of work and everybody just wants to get the work done and to go home. So what I'm saying is don't just develop your knowledge, also train yourself to be able to get stuff done fast, because that ends up being a very valuable skill in modern medicine. Now, a little more personal philosophy. Always strive to be learning and improving. You don't stay the same. You're either getting better or you're getting worse. So if you just coast and do the minimal to get by for the day, if you make a habit of that, you'll just progressively decline and be kind of mediocre. And it's no fun being mediocre. It's a lot more fun, being the best you could be. Things that help you to keep learning is always follow up an interesting case. Like you'll get a CT of the brain, MRI of the brain, there'll be a tumor or what looks like a tumor. Make sure you follow up that case. See, did it turn out to be a tumor? What were the biopsy results? That way you learn what really happened, and you'll have that real experience of knowing this turned out to be an abscess, this turned out to be a tumor. This was benign, this was malignant. So you develop that knowledge. The other thing is, look at the history. A lot of times there's pressure, go faster, and you don't have to look at the history, but I've learned tons of stuff from looking at the history. When I see a brain, for example, I will ask myself, why did this happen? Why is this brain so atrophic? This patient is young, 40 years old. Why should they have a brain like an 80-year-old? And I'll read through their history till I figure it out. And then that will help me the next time I get a brain on a 40-year-old that doesn't look right. I can remember that last case, and it gives me a focus when I go into the radiology scientific literature how to look that up. And I've learned tons of stuff like that. I've learned things that I don't even know how to explain how I learned them. Things like, women who have a hysterectomy before 35 years of age are predisposed to excessive brain atrophy and stroke in their 50s, okay? And I can only learn these things by understanding what was happening in terms of the clinical history and integrating that with the imaging findings versus the pressures of just recognize the imaging findings and leave the clinical history to the neurologist, the neurosurgeon, and whatnot. But if you do that, you'll be mediocre. You don't want to be mediocre. I would also say, too, help the referral service as much as you can. There is sometimes a tendency amongst radiologists to think that the referral service doctors are just a pain in the butt, wasting your time. You got a lot of work to do. Why should you be sitting around discussing cases with them? I think that's wrong. I think you should help the referral services as much as you can, because a good radiologist, I think, should be a good consultant, able to articulate all the stuff that the referral services need, like internal medicine when they come by, infectious disease, neurology, etc. If all you are is a fast, quick report without a lot of knowledge behind it, that's pretty easy to replace. I actually think every radiology department should definitely have people available that the other service can come by to discuss the films, because there's a lot of stuff that gets said when you're describing a case and discussing the differential diagnosis that simply doesn't get into a report. Reports have to be relatively concise. Speaking of reports, I'll make a separate lecture about reports because that's sort of a big topic and that would be incredibly boring for most people. But there's lots of stuff. In general, resident reports, and I think they stink. They're almost like functionally illiterate. So I just got one more minute here on this lecture. It's almost over.
Adam comes over and pay him after you're done.
Okay. All right. Sorry about that interruption. All right. Radiology resident number 2, always try to sit in the front row at conference. When you go to conference, one second, excuse me. Okay, sorry about that. When you go to conference, sit in the front row. It's a sign that you really want to learn. You'll learn more sitting in the front row. You can see the images put up on the board in front of the room much better. Always take notes. For example, it's weird, but there's always peer pressure to be stupid or to act like it's not cool to try to learn. I noticed that when I was a resident, I think I was the only resident, and I'm in a program where, at least half the residents were AOA, probably more than that. Like, it was not cool to take notes in a lecture. I go, what the heck? I'm here in conference to learn. I'm going to take a note. I would take notes on whatever was talked about in conference or the cases shown. I'd go home, I'd have a big box, and I'd throw the notes into the box. And that was stuff to be read. And then when I had some free time to study, I'd pull the notes out of the box and I would study that. So that's why I had really good retention. I knew that I had seen the case and I had read about it. And then the other thing was I put everything into Donnert. Oh, I don't have Donnert with me. Donnert is this book. It's an outline format. And sorry I didn't have the book with me, but I'll just open up any random book here. And basically, inside the book, I had all my notes. It's already organized in outline format. Donnert is sort of a summary book of what a radiologist needs to learn. It's alphabetized. There's an index in it. And I would add all my own notes of what the disease was, what the findings were. And the key thing is, everything is in the same book. So that I always knew how to find stuff quickly. Information is only useful if you can remember it, if you could find it. Whenever I read other books, like in other journal articles, I would cross-reference them into Donnert, either put them where the disease was discussed, or I would put them in the index. That way I was able to find everything. Also, that way anything I learned as a first-year resident was still immediately available to me when I was, a fourth-year resident, which is really the equivalent to being a fifth year after internship. So having a systematic approach to accumulating all the information and be able to find it later. Trust me, that's super important. I talked to some of these modern residents, and let me get my cushion. And they don't even know about Donnert, which is ridiculous. I own 3 copies of the Donnert book. One for studying at home, one for having in the conference room at the hospital so I could always have it to refer to during conference. And then I had another one in which I wrote all my mnemonics I'll show you the pictures of these when I make the one on how to make a radiology report. Sorry I didn't have them with me. That was stupid. All right. Read about whatever happened that day. You're emotionally connected to it. Our brain is programmed to remember things that we experience or that we're emotionally interested in. And that's about it. It doesn't remember random stuff well. What else about Donner? Yeah, there's my 3 copies there. In addition, when you study for boards, there's usually some recall questions. You want to do those recall questions. They're very helpful for studying for diagnostic radiology written boards. If there's a question book, there used to be one, maybe there's more now, and that was kind of helpful too. The outcome of these methods, my method is sitting in the front row taking notes and reading about it. I learned, we have like material you're supposed to learn as a radiology resident, and they kind of expect you. So you do an internship, that's the first year, but then we're not going to count that. Then you do 4 more years of diagnostic radiology, so you consider it a 4-year residency. It's 5 total, but 4 years of diagnostic radiology. And by the end of about your 3rd year, you're supposed to know the basic stuff. With my method of studying, I learned everything so fast, it became a waste of time for me to go to the resident taught conferences, which was half of our conferences after about a year and a half. I continued to go for almost 2 years, but I began to hate it. I felt like I was in kindergarten. We had attending run conferences. I always would go to those. Attending conferences are good because attendings know a lot. You know, they've been physicians for many, many years, and they know what matters, what doesn't matter. When residents show each other cases, it's a little bit like the blind leading the blind. The senior residents, you know, they know a lot more obviously than the junior residents, but it became a waste of my time. So I refused to go to conferences. The residency director told me to go to conferences, but I still refused. I'm not going to sit there and listen to baby talk. So then just, you know, what was the outcome though? I got punished for that. They didn't allow me to be chief resident, said I was not a team player, but they wouldn't let me run the conference either. I always won, of course, the attending conferences. Anyways, I finished written boards exam. It was like a 4 or 4.5 hour test. I was done in 1 hour and 10 minutes with a perfect score. I don't even remember a challenging question. That method of studying from Donner, it just, and sitting in the front row in conferences and reading about whatever I saw that day, I just had all the information, okay? And unofficially, like I said, for my neuroradiology boards too, I was told unofficially I had a perfect score. Okay, outcome of these methods, we covered that. Here's some other study methods. These are called liner boxes, and these are put in flashcards. At the time when I was a resident, I'd never even thought of using flashcards, but I subsequently have met other people that did incredibly well on their diagnostic radiology written boards, and they used flashcards. Liner boxes are a way to get yourself to focus on the material that you don't know. It's called spaced interval repetition systems, whereby the first flashcard, you look at it, and if it's really easy, you advance it to the second box. But if it's difficult, you keep it in the first box. So the point is, you spend more time on the difficult stuff because it's harder to get the difficult stuff to advance to the completion box. If you know it automatically, like it's instinctual, advance to the next box. So the easy stuff gets to the 4th box real fast. And the advantage of this method is that a lot of students spend too much time reviewing easy stuff they already know. Liner boxes not only get you to repeat the material, because you got to look at it several times before it sticks in your memory, but to focus on the difficult stuff. So it's a good method. Yeah, I already talked about the magic bathroom. Put a difficult textbook right here on the table so you always are looking at something challenging anytime you sit on there, and especially you're going to sit on there in the morning, right when your brain is more fresh. And then put the pictures on the walls of stuff you're trying to memorize and make yourself memorize it. And I'll do what I call like a walk and talk or a self-test. You know, turn your back to the picture and be able to describe everything. You should be able to see it all in your mind and all the labeling of every little anatomical region that's relevant to you. And then you know you got it. In addition, let's see, I think I got it. Let's see if I have good stuff to summarize the methods there. Okay, this is just another picture from the magic bathroom. There's a big textbook on the table, and here's some paperback I was reading at the time later. That's about Mark Schultz, the wrestler. Okay. Okay, here's a couple more things about study techniques. What really matters is long-term retention, that you have the knowledge in your mind. So whenever you learn something, don't just say, okay, now I know it. Ask yourself, is there anything I can do with this material to get me to remember this so that if I don't see it again for 6 months, it'll be fresh in my mind in 6 months? And so that's why you want to make word associations, mnemonics, visual metaphors. And they're all, if you just think about it, it's pretty easy. Like, let's say your fist is like a brain. This is like temporal lobe, frontal lobe, parietal lobe, occipital lobe. And I would make visual metaphors like that for different anatomical regions, and that would really help to jog the memory. And then we talked about space interval repetition system, handwritten flashcards and liner boxes, or Anki is now a good program on the computer for doing flashcards. Oh, just a few other words on the magic bathroom for studying. I saw the Monty Python skit, Every Sperm is Sacred. That made me think every void is sacred. So read every time you void. And then Mozart wrote, I think it only fitting to write while shitting. And so that gave me the idea. I think it only fitting to read while, doing that. So I got tons and tons of reading and studying done in the bathroom. Okay, and then we talked about the pictures on the wall to memorize stuff. These are just some other pictures of, again, some pictures on the wall. And then here I made some picture posters. This wasn't necessarily as helpful, these picture posters, but sometimes that was a way for me to visually memorize all the anatomical findings relevant, let's say the differential diagnosis for some key anatomical area. So that was one other thing that I did sometimes. It's like a giant flashcard, that poster there. You got to get along with people as a resident. You're going to deal with a wide variety of people. Most of them are going to be real nice, but you'll meet lots of stupid, obnoxious people too. Don't argue with them. Just be polite. They have to live with themselves. And you want to get on with your residency and your life. So you don't want to get bogged down in stupidity. So when somebody's rude or anything, you just politely refocus the conversation and do whatever's best for the patient and get on with things. The residents that are well liked are more likely to get a job offer in the residency program. They'll care more about who they like by far than about who is really good or talented. Always make sure all the work is done before you go home at the end of the day. The number one thing that pisses people off is if somebody doesn't do their work and dumps it on someone else. So make sure you don't go home until all the work is done. And that's always important for your entire career. Okay, and so that's the end of advice here for how to crush radiology residency. I'll make a separate video on how to make a good radiology report, because that gets a lot more into the details of how you format and what can be done with that. So hope it was helpful.